Hello and welcome to this EMS Education lecture. This lecture is designed for educators within EMS, and we're going to talk about how teaching in EMS really is a science and an art. There are two things we really want to focus on as educators, and that is the student-centered model and also how we're going to use our lesson plans, which are our instructional goals, to create conceptual knowledge for our students, which are really the learning outcomes that we would like for them. And with over 2,000 core objectives set forth by the standards in EMS curriculum, we really need to know how to sift and sort what is the most important information to deliver to our EMS students. And the way to do that is we need to understand our audience. We need to understand our students and where they're coming from and what their base knowledge really is, so we can build upon that. And that is called scaffolding in the EMS education world. And as we use a student-centered model to get students engaged, we want our environment to be primed for that. So our environment needs to be professional, free of distractions that aren't centered in that learning environment. It should be a dynamic process between student and student, student and classroom, and student and teacher. And we do that a lot of times we present a question to the classroom. We don't need to necessarily single anyone out in particular, but we present a question and we give pause and we let the pause land long enough to get students really thinking and active and let them chime in with what their response needs to be. And the old way of teaching, which was a teacher-centered model, was that we would stand in front of a classroom and we would lecture for a period of time. And that model has definitely gone away. We know that students need to get up from their seats. They need to move around. They need to get the blood flowing. We're very tactile people here in EMS, and as we use different domains of learning and teaching, we need to let students really get into some other modes in terms of their skills, like whether it's just the analytical brain or it's the psychomotor aspect, or it's actually putting it into clinical practice. And teaching critical thinking is extremely difficult. That's not really something we can necessarily just single out and teach, but it's through those lesson plans, how we create those lesson plans, that we will extract critical thinking and really let our students obtain that knowledge. And what we know about the brain is if we were just lecturing and letting people build pathways in the brain, they're receiving information from a teacher and just inputting into the brain, that's a very poor recall in terms of when they get into a situation where they need to remember, let's say, epinephrine doses and how to dose epinephrine in terms of like a pediatric cardiac arrest. But if we teach that one skill many different ways, as they have recall in their brains in these very high stress, high critical situations, they'll be better prepared to be better providers, which means that ultimately we give better care to our patients, which is definitely what we want. So we're going to focus on the student-centered model, really focusing on our lesson plans and how we're going to develop this conceptual knowledge for our students. And sometimes that looks like, as we teach 12 lead EKGs, we might bring in some case studies and some scenarios, and let's say like a video of a patient with shortness of breath who maybe looks like they're having a seizure, let's say per se, when actually they're having an anoxic brain injury due to their arrhythmia or dysrhythmia, and they can really solidify some of that learning in their brain, and then they go to the cardiac monitor and they see really what VTAC looks like, or they see what a complete heart block looks like, and they know that that low perfusion state equates to a lower mental status per se. And then maybe we also give them a research paper and they can write about, let's say, cardiac action potential, or they can write about sodium channel blockers, and they're really going to form conceptual knowledge in that way. Thank you so much for attending this EMS education lecture.